Hi, my name is Warren Alston. I'm with Trust Owens, Stokes Farnham in Greer and Travelers Rest, serving the upstate of South Carolina for a combined total of about 140 years. So, for the first time ever in the history of Trust Owens Stokes Farnham, we're going to be offering Medicare to our clients, and we're very happy to be able to do this. And I am the Medicare man. Warren Alston is my name. And so here, over the course of the next 10 weeks during the Medicare season, October, November, early December, we're going to be having regular Monday installments, Medicare Mondays we'll call them, where we're going to have informative educational videos that are going to help you have a better understanding of Medicare, how it works, and how it can best benefit you as a Medicare beneficiary. So it's important to say this now, that at Owens Stokes Farnham, we don't offer all Medicare plans that are available out there, but we do believe we offer among the best plans that are available. To know and find out all the plans that are available for Medicare beneficiaries, you can call 1-800-MEDICARE, or you can go to medicare.gov and get an all-inclusive list of all the different plans that are available in the particular area and zip code that you may live in. So today, in the first installment of Medicare Mondays, we're going to be talking about the basics, the beginner's course on Medicare and how Medicare works and what do all the different letters mean, the A, the B, the C, the D. We're going to talk about it today. And when we finish with this video, you'll have a good bit better understanding of how it all works. So Medicare comes in four basic parts. Medicare Part A is for hospitals. Medicare Part B is for doctors and service care providers. Everything happens outside of the hospital. Medicare Part C is Medicare Advantage plans. Medicare Part D is prescription drug plans. So, Medicare Part A, and I want you to see this in writing. Medicare Part A is for hospitals. If you were to get into an accident as a Medicare beneficiary, go to an emergency room, and in the emergency room, they're like, okay, you're hurt bad enough where you're going to have to stay in the hospital for a while, and that's 4 or 5 days. Then everything that happens with your care during that 4 or 5 days stay in the hospital is going to be covered under Medicare Part A. So Medicare Part A comes to most folks the month that they turn 65. The government provides this, and unless you are a very high income wage earner, the government's going to pay the premium for this cost. So Medicare Part A comes the first of the month you turn 65. The government generally pays the premium for this Medicare Part A insurance benefit. In some cases, it comes outside of that parameter of the month you turn 65. For people that have serious illnesses, end-stage renal disease, or other serious illnesses, including terminal illnesses, then they may qualify for Social Security disability income. They may be on Medicare at a much younger age than 65, but that is going to be dependent on their health status and their application status to get onto this Social Security disability insurance and start their Medicare dates earlier than age 65. Otherwise, for the most part, everyone's red, white, and blue Medicare card is going to have that Medicare Part A date, and it's almost always going to be the first of the month that they turn 65. Or if you turn 65 on the first day of the month, it'll be the first of the month prior to that month that you turn 65. So that's Medicare Part A everything that happens inside the four walls of a hospital. Next is Medicare Part B. Medicare Part B. Medicare Part B is everything that happens essentially outside of a hospital that has to do with your health care, which is going to be your doctors, your primary care physician, your specialist, whoever they may be. That's going to be covered under Medicare Part B. Also, service care providers, if you go to physical therapy, if you're getting blood work done, if you're getting x-rays taken, whatever it is that you're doing that's happening outside of a hospital is generally going to be accepted to be Medicare Part B. So Medicare Part B can start the same time that Medicare Part A starts, the first of the month that you turn 65. But it doesn't have to be that way. If you're still working past age 65 and your employer is providing your health care coverage past age 65, then your Part B date will be delayed at your direction past age 65. So if you were, for example, to stay employed and have your employer provided health care coverage till age 70, then just prior to your retirement age 70, when you come off of your employer provided coverage, you would go through a simple application process with Medicare and have your Medicare Part B date made effective. And whenever that date is, that would be your secondary date on your Medicare card. So Medicare Part A, usually the first of the month you turn 65. And then Medicare Part B can be that same date, but it can also be a later date of the date that you come off employer provided coverage, whenever that time may be. So those A and B dates can be the same, they can be separate. Medicare Part B also comes with a premium. This premium has to be paid by the beneficiary, and that premium changes every year. I believe that for 2024 year that's coming up, that premium is going to be about $174.80 per month. This amount changes every year over year, keeping in mind that Medicare is an annual year program, so all the deductibles start fresh on January 1st and go through December 31st every year. So when you're paying that Part B premium, it's typically taken from your Social Security check. And if you're not paying it, or you're not on Social Security, or you've delayed Social Security, then it can be billed to you, and that's typically paid on a quarterly basis as you move forward until you determine you want to have it taken out of your Social Security check. So that's Part A. Part B, these are the two dates that you'll see on your Medicare card that you'll get. And now we move on to Medicare Part C. Medicare Part C, Medicare Advantage plans. Medicare Part C is everything Medicare Advantage plans. Medicare Advantage plans, to simplify it, you're essentially taking your Medicare Part A and Part B, and you're assigning that to an insurance company that's going to provide for all of your health care coverage wrapped into one. They come in all different sizes and shapes and different types. Some Medicare Advantage plans include Medicare Part D prescription drug plans. Some do not. Some of them have extra services that they provide, like dental coverage, eye, vision coverage. Some provide health coverage like in a gym or a healthcare facility. Silver Sneakers is a widely known plan that some companies have, where you can join a gym membership at no cost and go work out there as much as you want, you know. So these are different types of things that are included with Medicare Advantage plans, and a lot of people find them very appealing. So there's also some noteworthy options about Medicare Advantage plans. Um, some of them are geared along the lines of HMO type plans, health maintenance organizations, where you're very restricted as to the doctors and hospitals and service care providers you can go to. Some are PPOs, or preferred provider organizations, where you have a little bit more latitude as to who you can go and see and what is covered. Some have lower maximum out-of-pocket costs for in-network providers, and then they have higher maximum out-of-pocket costs for going to providers that are outside of the network. Some of these plans travel well, where you can go out of state if you're traveling and see doctors, and some don't go so well, where if you're out of state or traveling away from your home area, you can only see a doctor or go to a hospital in the event of an emergency. So all of these plans have different points, different types of coverages. Some of them come with premiums of $0 per month. Some of them have small premiums in the 20s, 30s, $40 a month for the particular Medicare Advantage plans. So some people find these Medicare Advantage plans very appealing, low or no premiums per month, and in many cases their current doctors and service care providers they see can be a part of these Advantage plans. But you'll just have to check and see with whatever particular Advantage plan you may be interested in, is if your doctors are a part of those plans, and if your drugs are covered well by the drug plan that may be attached to that Medicare Advantage plan. In a future installment of Medicare Mondays, we will talk more about Medicare Advantage plans and go into a greater detail for your benefit to know more about Medicare Advantage plans. So, lastly, Medicare Part D. Medicare Part D is prescription drug plans. So Medicare Part D is everything prescription drug plans. These are going to be the kind of plans that where you're going to get your drugs. Okay, you can get them from mail order sources. You can get them from your local chain pharmacy. You can get them from your local grocery store pharmacy, whatever you prefer. Typically, the best way to know which plan is available for you, and there are some 27, 28, 29 plans according to your zip code that are going to be available. The best way to find out which one is best for you is to do like I said before. Go to Medicare.gov. There's a search engine there where you can input all of your prescription drugs, the name of the drugs, the dosage, how many you take in every day, and put those numbers in, and it will tell you which plan is best for the area that you live in and the list of drugs that you take. And you'll take that list and you'll be able to choose which plan you want and go through the enrollment process. And now is the time to do it during the annual election period, which is October 15th to December 7th. That's for the Medicare Advantage plans and the Medicare Part D drug plans. That's when you'll be enrolling for 2024 in this case, which starts January 1st. So keep this in mind. These plans change every year. Okay, some of the changes are subtle, some of the changes are large. So if you have a list of drugs with your Medicare Part D prescription drug plans, you want to revisit that every year and put your drugs into the Medicare.gov website. If you're not sure about that, if you're not comfortable with doing that, you got me. I can help you do it, okay? And get in. And what I do is I just take your drugs, I go in, I plug them into the Medicare.gov website. It tells me which plans are the best. And then we go through the process of enrollment, which is really not a difficult process at all to go through, and get all of that in place and taken care of so that it goes into effect January 1st. So this is it. We've covered Medicare Part A, which is hospitals, Medicare Part B, which is doctors, service care providers, generally everything that happens outside of the hospital. Medicare Part C, Medicare Advantage plans. We will be having a future Medicare Monday installment video on Medicare Advantage plans. And then Medicare Part D prescription drug plans will also have a future Medicare Monday on Part D prescription drug plans. So please subscribe and like and hit the notification bell, so as these new videos are coming out for Medicare Monday, you will have an insight to them, and you'll know that when they're coming out, and you can check them and have the information that you need to help make your very best decision. So thank you so much for watching this first in our installment of Medicare Mondays. Don't forget, subscribe, like, get notifications, and please remember, at Trusteau and Stokes Farnham, we're here for you. Thank you so much.